Heart disease is the world's #1 killer, and the scariest part? Many of its symptoms are silent. Today, I'm going to reveal 10 silent signs of heart disease you should never ignore. Stay with me, because number 7 is a symptom most people mistake for stress, but it could be deadly. First up, fatigue. If you're constantly tired, even after getting a full night's sleep, it might not just be burnout. This kind of deep, unshakable exhaustion can mean your heart isn't pumping enough oxygen-rich blood to your body. So, if you feel drained day in and day out, it's time to pay attention. Next, shortness of breath. Do you find yourself getting winded from simple tasks, like carrying groceries or walking up a short flight of stairs? If everyday activities leave you gasping for air, it could be a sign that your heart is struggling to keep up with your body's demands. Sign number 3 is swelling in your feet or ankles. Have you noticed your shoes feeling a bit tight lately, or imprints from your socks lasting longer than usual? This fluid buildup, known as edema, can happen when your heart can't pump blood effectively, causing it to back up in your lower extremities. It often points to early heart failure, so don't just write it off as a long day on your feet. Then there's an irregular heartbeat. Do you ever feel like your heart is racing, fluttering, or even skipping a beat? While a little palpitation here and there can be normal, a persistent, irregular rhythm might signal a condition called arrhythmia. If left untreated, some arrhythmias can be dangerous, so it's a symptom you definitely want to get checked out. Sign number 5 is dizziness or fainting. Feeling lightheaded or like the room is spinning can be disorienting and scary. It happens when your brain isn't getting enough blood, which could be because your heart can't pump it strongly enough. If you experience these spells, especially if you actually faint, it's a major red flag. The 6th sign is chest discomfort. Now, when we think of heart problems, we often imagine a sharp, crushing chest pain. But it's not always that dramatic. Sometimes, it's a more subtle pressure, a burning sensation, or a feeling of tightness, like a band squeezing your chest. Any new or unexplained chest discomfort should be taken seriously. And here it is the sign most people mistake for stress: sleep problems. If you have trouble falling asleep, or worse, you wake up suddenly gasping for air, it's not just a bad dream. This can be a sign of sleep apnea or fluid building up in your lungs because your heart isn't working properly. It's a critical warning that your heart is in danger. Sign number 8 is a persistent cough. A nagging cough that just won't go away, especially if it produces a white or pink-tinged mucus, could be another clue. This can happen when fluid accumulates in the lungs due to heart failure, and your body is trying to clear it out. Sign number 9 is pain that radiates to your jaw, neck, or back. Heart-related pain doesn't always stay in the chest. It can travel up to your jaw and neck or spread across your shoulders and back. Many people, especially women, experience these atypical symptoms during a heart event. Don't ignore pain in these areas. Finally, number 10, nausea or indigestion. That upset stomach you're blaming on last night's dinner could actually be your heart. Some heart problems can manifest as feelings of nausea, heartburn, or general stomach discomfort. If it occurs alongside other symptoms like shortness of breath or dizziness, it's a serious warning. These symptoms may seem minor on their own, but together, they could be your body's urgent warning of heart disease. If you notice them happening often, please talk to your doctor immediately. Early detection can save your life. Stay heart healthy. If you found this information helpful, please like and share this video. And don't forget to subscribe for more life-saving health tips. Thanks for watching.